Guys, this is Ritinder Kaur and welcome back to my channel. And a happy new year and prosperous new year to you all. And today we are going to talk about 5 moments of hand hygiene, which is very important as a healthcare worker. We should know these 5 moments of hand hygiene. So let's talk about the 5 moments. We'll talk two befores and three afters. The two befores are before touching the patient, when you are going to the patient and talking something or doing something. So that time you should do hand hygiene. You can use sterilium, or you can use hand wash also, water and hand wash. That type you can wash your hand, and this type of hand hygiene you can do. So this is first, before touching the patient, and second is before doing any aseptic techniques, like you are doing catheterization or intracath. You are putting intracath in patient's hand, intracath or vasofix in patient's hand. That time you should always do hand hygiene. And let's talk about three afters. The first is after touching the patient. When you have done something and you have talked with the patient and something like that, that time after touching the patient, you should uh, do this hand hygiene. And the second is after touching the patient's surrounding. So when you are working surrounding the patient, or doing something with the uh, something which is related to the patient, or which is surrounded by the patient, or some things like uh, the trays and the BP apparatus. You have used BP apparatus, you have given medicines to the patient, like these type of things. When you have touched patient surrounding, that time, after touching the patient surrounding, you should always do hand hygiene. And the third is after any body fluid, after any body fluid exposure, like you were doing something with the catheter and suddenly the urine spill into your hand, or you were doing you were putting intracath in patient's hand, and the blood came and touched your skin or spill on your skin, like that. Like these type of body fluid exposure, after these, you should always do hand hygiene. And I prefer you should always wash your hand with soap and water. So these are the 5 moments of hand hygiene. uh, let me say it again. First is before touching the patient. Second is before doing any or performing any aseptic techniques. Third is after touching the patient. Fourth is after touching patient surrounding. And fifth is after any body fluid exposure. So these all five moments of hand hygiene you should always perform, and make yourself uh, away from the infection, and can prevent the infection spread from one person to another, from patient to yourself, and from yourself to patient. So this is very important. So I think you have learned 5 moments of hand hygiene. Thank you so much for watching my video. Please share, subscribe, and like my video. Thank you so much. If you need these type of informative videos, so please follow me and subscribe me. Thank you so much.